I'm Bree. I'm going to be your nurse. I'm here to do a head to toe assessment on your newborn. I'm going to wash my hands, provide privacy, make sure baby is placed somewhere safe, and that this is the right baby. All right, baby is awake. She's not crying, although she was a little startled by the door closing. All right, I'm going to go ahead and check her heart rate before we get her all worked up. All right, heart rate was 122. Respiratory rate's 40. She weighs 6 pounds, 2 ounces. Her length is 19 inches. We're gonna take her head circumference, which goes around her head above her ears and eyebrows. That is 13 inches. I'm gonna do under her back and under her arms for her chest circumference. That's 12 inches. All right, I'm gonna lift her arm and get her temperature. That's 98, and I'm also noticing some vernix under her arm, which is that white creamy buildup. Right, and this baby was born at an APGAR score of 9, so she looks good. If it was under 7, we would have had to continue to assess her every 5 minutes until her score was above a 7. All right, so I'm going to take a look at her skin. No webbing between her fingers or toes. She has 3 palm lines on each hand. There's a little bit of acrocyanosis, which is normal. That's the bluish color on her hands and feet. I don't see any port wine, strawberry, or Mongolia spots. She does have some stork bites on her forehead that do blanch, as well as a little bit of Malia across her nose. That's those little white bumps. All right, so now I'm going to palpate her scalp. There's no swelling present. I'm gonna check her anterior fontanelle, which is diamond shaped, and it should close by about 18 months. I'm gonna check her posterior fontanelle, which is triangular. That should close by 2 months. If those are bulging, that's a sign of intracranial pressure, and sunken is a sign of dehydration. All right, now I'm going to take a look at her eyes. All right, good. There's no sign or no yellowing or redness of the sclera, no abnormal reactions. Her ears are evenly shaped and not too high, not too low. I'm going to check for patency on both sides of her nose by just closing one side at a time. All right, and then I'm going to look in her mouth. There's no holes in her palate. There are some little white papules. Those are called Epstein pearls, and they're painless and they'll go away on their own. Her mucous membranes are pink and moist. There's no teeth noted. I'm going to put a glove on and check her suck reflex. That's good, as well as her gag reflex is good. All right. And also when I came in and closed the door earlier and she threw her arms up because she was startled, that's a good sign for her Mars reflex. It's also a good indication that she's hearing well. Now I'm going to do her tonic neck reflex. I'm going to turn her head to the side, and the side that her jaw is over the shoulder on, that side should extend while the other side flexes. Right, and the same thing should happen on the other side. Good. All right, we already listened to her heart. Her heart rate was 122. There is a little bit of breast enlargement from maternal hormones, but there's no drainage. I'm going to listen to her bowels. Her bowels sound good. She already had her first meconium stool, so that's a good indication that her anus is not closed. I'm going to palpate. There's no bulging around her umbilical cord. She has 2 arteries which carry deoxygenated blood and 1 vein which carries oxygenated blood, and the Wharton-Strelly helped assist in clamping off that umbilical cord. I'm gonna clean it with an alcohol wipe to help dry it up some more. All right, she has a wet diaper, so that's a good sign. She's not dehydrated. Her labia is slightly swollen, which is also due to the maternal hormones, and there's no Rugae present. That's more around 4 weeks. We'll start seeing that as the swelling goes down. She's only a couple hours old, so it's normal to not see that yet. All right. And now I'm going to check her range of motion. Oh, we're going to listen to her lungs first. All right, lungs sound good. There's a little bit of crackles. That's normal just from the fluid from pregnancy. Her respiratory rate is 40. Newborns have periodic breathing, so if you notice her not breathing for about 5 to 15 seconds, that's normal. Longer than that, though, is concerning, and you need to report it. Signs that she's in respiratory distress could be chainsaw-like movements on her chest and on her abdomen. If her nostrils are flaring or the skin around her ribs and her sternum are sinking in while she breathes. Those are all signs of respiratory distress to look out for. Let's see, their breathing patterns become a little more normal at night. All right, so now let's check her capillary refill actually. All right, that's good. That's less than 3 seconds. All right, so I'm going to check her range of motion in her arms and in her legs. For the Ballard scale, the posture looks good. The square window. All right, arm recoil. Let's check popliteal angle. And we're also listening for a hip click. There's no hip click. Her gluteal folds look even. All right, her scarf sign is normal, as well as her head to ear. All right, so the 3 shunts are ductus, venosus, foramen ovale, and ductus arteriosus. And they basically shunt blood away from her weaker parts that don't need it as much, like they shunt it away from her liver and provide it to the rest of the body, I believe. And the 4 types of heat loss are evaporation, radiation, conduction, and convection, and you can prevent those by keeping her bundled up and the room temperature that she's in a comfortable temperature for her. Make sure she's dry and not sweating, or in front of a fan or by an open window. Let's see, and I believe that's it.